using routine outcome monitoring and feedback works. It helps to improve treatment outcomes. Despite that, it's not the majority of psychotherapy services worldwide that use this technology. In fact, it's probably a minority of services that do this systematically, routinely, and do it effectively. So why is it that services don't do this already? There are several barriers. In order to break those barriers down and to implement this effectively, we've written a book chapter that maps out some of the common barriers. There are some practical ones, some policy-related barriers, some technological barriers, some related to knowledge and skills. But we've also outlined a series of enablers, things that services can do in order to successfully adopt measurement and to use it in a clinically effective way. One of the common obstacles to adopting measurement is something that's called the burden fallacy. So this is the erroneous belief that patients will find completing questionnaires either burdensome or aversive or problematic or difficult in some way. So often therapists might say things like, I chose not to give questionnaires to this patient because I didn't think they could handle it. They might get alarmed or distressed. Or they might say things like, I didn't use measures with this patient because it might interfere with the therapeutic alliance. All of these are examples of this burden fallacy where therapists expect that it's going to be more problematic than helpful.
Implementation is one of the biggest concerns in routine outcome monitoring in terms of the uptake, so to say. And I think there's several levels of barriers. So there's definitely some barriers at the attitudinal level from the therapist point of view. So not all therapists like feedback. There's even some studies that suggest that therapists would choose not to use outcome measures even if it enhances the outcomes of treatment, which I think is a pretty bold statement to make. But it has been found in earlier studies. And obviously that's still happening because therapists are aware nowadays about the potential benefits of using Raman feedback and still choose to not use it sometimes. It seems like it's fear-based. So I think, especially if you're working as a therapist for a longer time already, we do not have a lot of structural information in our way of working about how we're doing. We do not get very much performance information as therapists. Nowadays, systems that have implemented routine outcome monitoring do have this information, but still it's typically not fed back to therapists. So they do not know actually how well they are doing as a therapist and how good they are in their profession. And so I think there's always this fear that, what if this is going to show that I'm actually not so good a therapist?
Many, many years ago, in the early days, I was involved with an implementation of an outcome system in an organisation within England. And what we developed was a system of what we called hopes and fears. That is that it's no good implementing ROM because I think it's a good idea, or you think it's a good idea, or the manager thinks it's a good idea, because people will resist, and at worst they'll sabotage it. So what we did was we got everyone together and we went through and we had an open session asking people what were their hopes for implementing outcome measurement and evaluation in that way. And people kind of air their views. And then what are their fears? And gradually people will come out and say, well, I'm worried that I'll be found out that my therapy, I'm a therapist, I'm no good, or whatever. And I think it's by sharing those views, people start supporting each other, and it gets it out into the open. And I think that's a very good place to start. But again, it emphasizes why implementing ROM is an organizational intervention in that way. It's not just one person, one measure, and that's it.
Implementation is complicated, and the barriers and difficulties could vary from clinic to clinic and country to country. For that reason, as part of the book, we've interviewed several experts in the field who have successfully implemented routine outcome monitoring and feedback in a variety of clinical settings. In this book chapter, we provide some case studies and a collection of top tips from these experts who've been able to successfully overcome common barriers.